Hello everyone, this is Carolyn again, and we're going to talk about evaluation and specifically the 3 phases of evaluation that we discuss in several of our trainings. Now, as you know, I am an evaluation obsessive. You know that, right? You've spent time with me. And one of the ways I like to describe evaluation is that it's a tool or a technique that gives us extremely valuable information about our program. Now, the model of evaluation that we use, or the approach that we take in training, is the 3-step model of evaluation. So we believe that there is a formative phase of a program, and this is formative, i.e. it is the planning phase of the program, the time when we're thinking about what we're doing, why we're doing it, how we're going to do it, and we're thinking about actually the detailed action plan. Then once we put the program into the field, so once we launch, once we're implementing, then we need to be implementing and monitoring that process. So that is process evaluation. Process evaluation is really about seeing, is it happening as planned, is it happening on time, and we talk about, is it happening with fidelity? In other words, is it true to the plan that we developed? And finally, we want to know whether our program made a difference, and that's when we think about outcome evaluation. So just keep that in mind, the 3 steps: the formative evaluation, the process evaluation, and the outcome evaluation. The problem, as you know, and as many of you have raised in our trainings together, is that very often there's no funding for evaluation attached to a program grant. And if there is funding, the funding is there for outcome evaluation. And so many of you have shared with me that if you do evaluation at all, or historically if you did evaluation at all, it was always about outcome evaluation. Now, I think the point of having outcome evaluation is that it's supposed to tell us whether we're succeeding, whether what we're doing is working, and to some extent it's about our accountability. So is this investment that the funding agency is making, is the investment that they're making in us worth the money? Are we being good stewards of these resources for the public's health? But as you know, I am deeply concerned about the idea that we only fund outcome evaluation and that we only do outcome evaluation for several reasons. The first is that when we do outcome evaluation, we're coming towards the end of this process. We've done what we're going to do, and we're looking to see whether or not it's worked. Well, by this point, we've got very little control over changing that outcome. And so even if we identify problems, there's nothing we can really do to change the outcome for these recipients at this time. We would have to wait for the next cycle. We would have to hopefully learn from these mistakes and revise our program so that we could improve next time. The problem, though, is that if I've only collected data about the end, about the outcome, I don't know what happened. I don't know whether the program was designed properly. I don't know whether it was delivered properly. So the reality is that if I only do outcome evaluation, I don't know why things happen. So if I get a great outcome, which is fantastic, I don't know why. So my program worked, fabulous. Why? I don't know. Which means that I can't adjust it, and other people can't learn from that and replicate it. If it didn't work, I also don't know why. And let me just reassure you that if your program does not work, but you know why that was, so you know why it failed, that's good, because it's going to stop you from making the same mistakes a second time. Now, a concept that we talk about again and again in the training is this: get really comfortable with the idea that if you are working in practice, if you are working in the field with all the variation of life and all the things that happen, or as you once told me, all the firestorms that pop up every day, then problems are going to happen. It's not if they're going to happen, it's a question of when they're going to happen. And the critical question for you as the program planner is, have you set up your program plan in such a way that you have built-in early warning systems so that you know if people don't like your program, you know if they're not showing up, you know if you're getting an unexpected negative reaction to something that you're doing, so that you know if something's taking longer or if people are not responding. You need to know these. So it's fine to be comfortable with the idea that problems always happen when we're working in public health practice. What's not okay is that we know that this happens, and we don't plan evaluation strategies to monitor for those things. So, problems happen, we know that. And so what we also know is that the sooner we start evaluation, the more helpful it's going to be to us. So if I start evaluation right from day one, thinking about, do I have my problem diagnosis correct? Is this intervention something that's supported by evidence? Do I have the right partners on board to do this with me? Do I have enough time? All those sorts of things. If I start early asking these questions, then it's going to be really very helpful to me. It also gives us the opportunity to adjust, because in program delivery, it's not really like a research project where we're wanting to hold everything very, very steady and very constant. The reason we use this evaluation in the field is so that we can adjust if necessary, so that we do no harm to our clients, and so that we get the best outcomes. So many of you then raised the question, and this is a very smart question, well, if I don't have any money to do evaluation, how on earth am I going to find money to do more evaluation? And this is one of the sort of strange ironies of evaluation. And please remember, I'm not talking about big evaluation research projects here. I'm talking about evaluation built into the life of your programs. The earlier you start your evaluation thinking, and the more you do of it, and the more you use evaluation in the design and implementation phases of your program, the less your program is going to cost you ultimately. Now, I'm not saying that evaluation costs nothing. That's absolutely not what I'm saying. But what I'm saying is that good evaluation done through the life of the program helps you avoid expensive mistakes. So things that people didn't want, redundancies, maybe missed deadlines, which delay projects, or missed purchasing deadlines so that everything costs you more. And so ultimately, as we use evaluation on the way through our programs, it's almost like our management associate. It helps us avoid bad decisions about our programs. Now, you know, all of you who've worked with me even for 5 minutes, that my very, very favorite type of evaluation is formative evaluation, that evaluation that we do on the way through the planning process. I think it's important not just for practical purposes in terms of whether we have the right program. I think it's not just important because we're trying in public health to look at evidence-informed programs, but I think it's important for ethical reasons, in that we do not have a right to go into the community and inflict badly designed and badly implemented programs on our community members. If we tried to practice medical care in the hospital without taking histories, without assessing for pre-existing conditions, without checking for existing allergies, for example, and then if we were to implement treatment, and maybe even half-hearted treatment or low-quality treatment, and then we didn't even monitor it to see whether or not there was a negative consequence for our patients, that would be malpractice. And as I've said to you several times when I've been on my soapbox in the training room, I think that this is malpractice in public health. We need to be using evaluation on the way through the planning, on the way through the delivery, and hopefully if we do that, we're going to get some great outcomes. So the last slide I'm going to show you is the one that I like to remind us all about, and that is the danger of familiarity. I think very often when people are designing new programs or working in new communities with new populations, they understand that we need to do formative work. We need to do formative research. We need to pilot test our materials. We need to monitor that first period of implementation very carefully with evaluation. But you know, we've had these conversations about, you think you're driving to work, you think that this is the day that you're going to work, you come to the end of the street, you make a left, because you always make a left when you go to work. And then when you've turned left and you're heading to work, you realize this was your day off and you didn't need to turn left at all. You were trying to go somewhere which required you to turn right. And so sometimes when we're really very familiar with the territory, we're very familiar with the people, we're very familiar with the content, we're very familiar with the program, we become careless and we stop looking for things that we need to be looking for. Because remember, maybe our program hasn't changed, and maybe our intentions haven't changed, but the context in which we are implementing our programs have changed. And it is our responsibility as public health professionals to make sure that we're aware of that and that we continue to adjust our programs in a way that is going to best serve our clients. So thank you for putting up with my preaching. You know I always preach about evaluation. So thank you for indulging me, and I hope that you will use it and use it often and well, and that it will provide you with extremely valuable information.